Welcome back to NYSORA YouTube channel. Dr. Hadzic here, and if you have not subscribed to NYSORA YouTube channel, please do so now because there's quite a few great videos coming out soon. Today we're going to talk about superficial peroneal nerve block. Now this nerve is very important to accomplish when you do an ankle block for foot surgery, but there are few tricks and important tips to make this block successful and easy to identify each and every time, which we're going to share in this video. We're going to use the NYSORA's compendium of regional anesthesia to demonstrate the anatomical facts, but that's the superficial peroneal nerve. And if you pay attention to this image here, you will notice that the most important things to remember for the superficial peroneal nerve block is that injection is made basically in between the two tissue sheets, which are separated by a tissue fascia that stretches from the fibular ridge to the superficial fascia. But in between these two compartments, there is a superficial peroneal nerve where the injection takes place either in plane or out of plane. Now, why would we want to do this block? Well, if you scroll down a little bit, it is these folks that are having corrective hammer toe surgery, corrective osteotomy, bunionectomy, and for this you really do need 3 nerve blocks. Tibial nerve block, which we talked about in an ankle block video earlier. You need a deep peroneal nerve block that covers this particular part of the skin and the bone and intrinsic muscles. And finally, the superficial peroneal nerve, which provides anesthesia or analgesia, or if you will, sensory coverage of this part of the leg. And while the block is relatively easy to accomplish, once you know where the superficial peroneal nerve is, it really takes some skill and some important tips, which we're going to teach you just in a minute, in order to be able to recognize the nerve each and every time. And for that, we're going to refer to the clinical video. And here we go. We can see the transducer is positioned just over the tibia. And that's the tibial bone right there. So let's just outline this real quick. So that is the tibia right here. We don't see the fibula anywhere here, but we're going to talk about this in a little bit. But that's the tibia over here. That's a superficial fascia. So in here, as you can see, we're using a NYSORA fabled nerve block app, which we attach to the ultrasound machine so we can reproduce exact anatomy. That is the transducer over the tibia. What we're going to do is a lateral maneuver, so lateral slide, in order to identify the fibula. So let's repeat this maneuver one more time. Transducer on the tibia, lateral slide to identify the fibula, and a very slight tilt downward or caudally. This is very important, and each and every time that we do this block, we actually stress this out to the residents. And there we go. So if you look at it now, we actually see all the elements we want to see. Tibia, we have left it because we have now slit the transducer more laterally. We can see the superficial fascia, but very importantly here, we see now the fibula. And if you see the ridge of the fibula, that's really the most important information, because from here to there, there's a fascia that connects the ridge of the fibula to the superficial fascia, and in that layer there is the superficial peroneal nerve. Now clearly, going this way, we're talking medial, so this is anterior compartment, this is lateral compartment, and in that compartment is the nerve that we're looking at. And now we're going to use actually an in-plane technique. This allows for better needle visualization, just like it shows on our app. And that's the needle path. In short, superficial peroneal nerve block is really an easy block to do, but you must follow these maneuvers that we just talked about. Extremely important is to go in steps each and every time. The first step is to recognize the tibial ridge. The second step is to slide the transducer laterally to recognize the fibular ridge. The third step is to recognize the fascia or the septum that divides the anterior from the lateral compartments. And at the point where this septum connects to the superficial fascia in the triangular space, we will always find the superficial peroneal nerve. And now let's review the entire procedure from the beginning to the end by watching the ultrasound video. So here we have the anterolateral scan below the knee. That is the tibia now. So once we identify the tibia, on the surface there will be superficial fascia that we talked about. The step number 2 would be to identify fibula. This is very important to identify because we want to make sure that we identify the septum that goes between the anterior and lateral compartment. We mentioned that a slight tilt downward is necessary to identify that fascia as well as the superficial peroneal nerve. Once we do that, the next step is to introduce the needle either in plane or out of plane. It does not really matter. Here is the needle breaching the superficial fascia and approaching the superficial peroneal nerve, and we simply inject the local anesthetic in the triangle. And the triangle is created by that septum that divides the anterior compartment from the lateral compartment and basically spreads to attach to the superficial fascia. It is in that compartment here where the superficial peroneal nerve is. And that was the superficial peroneal nerve block. Thank you for watching, and if you do like our videos, make sure you subscribe. That way you will not miss the beat. Until next time.